Welcome to our latest video, Top 10 Countries with the Highest Mortality Rates, a global overview. In this eye-opening exploration, we will delve into some of the nations grappling with the most significant mortality challenges. From Bulgaria, which tops the list, to the broader demographic crises in Ukraine and the health inequalities faced in Latvia, we'll analyze the complex interplay of factors contributing to these staggering statistics. Join us as we uncover the realities behind each nation's struggle and the pressing health issues they face. 1. Bulgaria, the highest mortality rate in the world. Bulgaria tops the list with a mortality rate of 15.6 deaths per 1,000 people. The major causes of death are non-communicable diseases, similar to those seen across Europe, including circulatory, digestive, and respiratory ailments. Bulgaria's demographic crisis highlights a population decline from about 9 million in 2000 to projections of perhaps as low as 2.8 million by 2100. The country's declining birth rate exacerbates its future demographic challenges. Notably, Bulgaria underscores the link between health infrastructure and mortality, with aging population trends deepening this issue. 2. Ukraine, a nation in demographic crisis. With 15.2 deaths per 1,000 people, Ukraine's mortality rate evidences a demographic crisis magnified by a low birth rate. Poor healthcare financing further burdens the population, illustrated by low vaccination rates and an alarming growth in preventable diseases. The rampant alcohol and tobacco use among working-age males contributes significantly to Ukraine's mortality. Additionally, the swift rise of HIV/AIDS cases and recent measles epidemics highlight critical healthcare gaps. The ongoing conflict with Russia poses further risks, likely intensifying mortality rates. 3. Latvia, a struggle with health inequality. Latvia's mortality rate stands at 15 per 1,000, primarily affecting men, individuals with low education, and low-income citizens. Although life expectancy is improving, socioeconomic disparities remain stark. Unhealthy lifestyles, including high rates of smoking, binge drinking, and obesity, perpetuate health issues. These factors contribute to Latvia's mortality rates, showcasing significant health inequities and their impact on vulnerable populations. The disparity in life expectancy between educational levels further emphasizes these challenges. 4. Lithuania, high rates of heart disease and stroke. In Lithuania, the mortality rate is 14.4 deaths per 1,000, driven prominently by ischemic heart diseases and strokes. Smoking, a leading risk factor, contributes to lung cancer being the third largest killer. The country's life expectancy lags in the EU, highlighting issues compounded by smoking and dietary habits. This situation indicates the need for public health initiatives focused on lifestyle changes, such as smoking cessation and improved healthcare access. 5. Romania, healthcare deficiencies and emigration. Romania shares the world's fifth highest mortality rate at 13.4 deaths per 1,000 people. The shortage of medical professionals exacerbates mortality challenges, as many doctors have departed since 2007 for better opportunities. Consequently, high infant mortality rates and a lack of specialized care prevail. Diseases like cardiovascular and respiratory infections, alongside liver and kidney conditions, are predominant causes of death. This emphasizes the necessity for healthcare reform and retention strategies for healthcare workers. 6. Lesotho, the burden of disease. Lesotho's mortality rate of 13.4 per 1,000 partly results from an overwhelming disease burden. With life expectancy at merely 51.5 years, the healthcare challenges are dire. High rates of HIV/AIDS, tuberculosis, and lower respiratory infections account for much of the mortality, pointing to inadequate healthcare resources. Efforts to improve access to basic medical services could significantly lower this rate. 7. Serbia, an aging population. At 13.3 deaths per 1,000, Serbia's aging demographic contributes significantly to its mortality rate. Cardiovascular, lung, and kidney diseases are the leading causes. Serbia's smoking rates are among the highest globally, complicating public health efforts. The demographic structure, particularly the aging population, requires strategic healthcare planning to manage the diseases prevalent among older adults. 8. Croatia, an unhealthy lifestyle epidemic. Croatia faces a mortality rate of 13.3 per 1,000, with prevalent causes being heart disease, strokes, and various cancers related to lifestyle factors. The smoking prevalence in Croatia is high, along with a rising obesity trend in children, signaling future public health issues. The growing obesity rates necessitate early intervention through education and lifestyle changes. 9. Russia, the challenge of alcohol abuse. With a mortality rate of 13.1 per 1,000, Russia confronts significant public health challenges. The widespread alcohol abuse, particularly among men, significantly influences mortality rates. Cardiovascular disease and cancer are the top killers in Russia, reflective of the unhealthy lifestyle and social conditions. Comprehensive public health strategies focusing on addiction and lifestyle changes are crucial. 10. Hungary, balancing modern medicine with lifestyle risks. Hungary closes the list with a mortality rate of 13 per 1,000 individuals. Here, diseases such as cancer, circulatory disorders, and injuries consistently top the causes of death. Notably, adult obesity, hypertension, and substance use exacerbate health risks. While advances in healthcare have increased life expectancy, prioritizing preventive care could yield further health gains. In conclusion, while countries with high mortality rates face numerous challenges, addressing underlying causes such as healthcare accessibility, lifestyle modification, and socioeconomic disparities could mitigate these issues. Each nation listed offers unique insights into global health issues that require tailored strategies for improvement. Continued collaboration and innovation in public health policy will be critical to reversing these trends and improving life expectancy worldwide. Source: